Hi, everybody. Welcome back to Care Anywhere. I'm your host, Lea Sims. This is our final episode being recorded here on the floor of the International Council of Nurses 2025 Congress. I've been interviewing some incredible nurses this week who have such powerful stories, not only about their own journeys as nurses in the profession, but how they're giving back and paying forward their own experience into the next generation of nurses coming up. I'm joined this morning by Annesha Archyangelio, who is a nurse in the UK who has spent a lot of her time building resources and creating opportunities for foreign educated nurses who come into the UK to work. Welcome. Welcome. So nice to have you here.
Thank you for having me, Lea. It's really great to be here and to have this podcast here at the Congress.
Yes.
Thank you.
Thank you. All right, let's start with you introducing yourself. Tell our audience a little bit about who you are. We'll talk a little bit about your own migration journey, and then we'll jump into some of the resources that you've been creating.
Yes, thank you very much. So my name is Annesha Archyangelio, as Lea said. My background is that I'm a foreign educated nurse. I was educated in Jamaica, trained as a nurse, and I migrated here to the UK. And that's about 2 decades ago, would you believe it? And over that time, I've accessed quite a lot of resources that is available in the UK, in England. Developed myself up to director level. I'm now a regional director of nursing. And some of those resources I've written in here, my book.
Yes.
And I would like to share this with colleagues across the globe about accessing talent development, other resources about recruitment, education leadership research, and supporting those from a diverse background.
Great. Yeah, we're going to dive into some of that and what's in here and why it's so important and valuable to nurses who are stepping into the next phase of their career.
Yes.
And new cultures, new organizations, new countries.
Yes.
But one of the questions we always start out with on our podcast with nurses, particularly because we have such a nursing audience, and a lot of our audience are new nurses or those who are considering the profession.
Yes.
And we love to talk about career pathways.
Yes.
And because no two nurse journeys are the same.
That's
Everyone
it.
has a different story. What inspired you to become a nurse? Why did you get into healthcare as a career? We'd love to know about that.
Yes. So my inspiration around becoming a nurse started clearly in Jamaica when I was a teenager, and I used to visit the local hospital to volunteer. And I remember observing a burns patient within the unit, and I just thought this is something that I could do within resources as was available then. And then I decided I will study within the Kingston School of Nursing. And from there on, I realized that there's always the next step, progressing up, doing something different. And while I was studying in Jamaica, I explored all the hospitals and systems there. And after that, I just wanted to spread my wings and understand why the healthcare system, which brought me in the UK. And now I am exploring global work and initiatives.
Yep. Did you come to the UK initially to study, or you had already completed your study and then came to work?
Yes. So I'd already completed my study. I've worked about a year in Jamaica because I think once I learned something, I really want to explore the next step. So I think within the year, I'd already understand the full system and just wanted to have a bigger understanding. So yes, I was already qualified. So I'm classed as a foreign trained nurse or internationally trained nurse.
So talk about your migration journey, what it was like for you. It's a process for people who haven't gone through that, who've had to, explore career mobility and take their careers to another country. There's a lot of regulatory gateways that you have to go through. There's often a long wait. What was your migration experience like?
Yes. So in fact, my migration experience is where I came across with my husband, who was also a nurse, and thus the very long last name there. Yes. So essentially, we both came as nurses, and from Jamaica, our training allowed us to work directly into the UK. We didn't need additional training. All you needed to do was just to register with the NMC. So that took about a few weeks. So whilst I was waiting for my registration, I would work as a healthcare assistant, a couple levels down, and gain some income while waiting on my PIN number. It took just about 6 weeks. It didn't take very long for me. And also there's the OSCE for nurses from other countries, say Africa and some Caribbean island. And for non-English speakers as well, they need to have evidence of English.
Yes.
My home language is English. So all of these resources is in this book that we spoke about here.
Good. Let's
Yes.
talk about that. So
Yeah.
what inspired you to start pulling these resources together? I'm sure it was
Yes.
inspired somewhat by your own journey, and then probably also working with other nurses in the UK who've gone through the same journey. Talk about what led you to write this, and then some of the content that's
Yes.
in here and how it's resourceful and helpful to nurses who are
Okay.
coming into the UK to work.
Yes, brilliant. So it's a journey. So I'll shorten it. So my specialism, as you say, there are different career pathways. It's never linear. Mine was through the specialist route as an infection prevention specialist. When I was a deputy director for infection prevention and control, I was lucky to get a fellowship as a National Chief Nursing Officer Fellow within England, working with the CNO for England. And there I developed something called the Matron's Handbook for middle managers across England, and I implemented that with well over 200 hospitals. And
So this isn't your first book?
this is not my first book.
Yes.
That's a story.
Yeah.
Yes. And so then I was spotted by various colleagues. I was actually spotted by Robert from Elsevier Publishing Company.
Yeah.
And they approached me and asked me to write the book. And I said yes straight away, because I'd already been gathering lots of evidence for my previous work, but also for myself and anything that I wanted to share. So I think in the back of my mind, I wanted to document everything in a book. So I was very glad to have this opportunity to write an official published book. And so there and then I worked with the publisher to gather all the information, make sure it's research evidence, and everything that you can think of you want as a internationally qualified nurse, those are diverse background in even UK or abroad. You can find information around those things within the book.
That's great.
Yes, but it's also useful for people who are not from a diverse background as well, because it's really just anything that will support you to develop up to a senior level.
So even if you were a nurse trained in the UK wanting to work there, you'd find value in
Yes,
preparatory material.
pathway.
Yeah. So the title of this book is International Healthcare Professionals Handbook, a success guide to working in the UK for nurses, midwives, and allied health professionals. I'd love to talk a little bit about the content here, what I'm seeing across the spectrum of content in this book, preparing internationally recruited staff for successful completion of the international recruitment process. As we said before, it's a complex process.
Yeah.
There are a lot of regulatory gateways to go through. At testing
Yes.
and at licensure and
Yes.
education comparability. Those are all the things we evaluate at True Merit. So that this would be incredibly helpful, I think, for people who are needing to navigate
Yes.
that process. Other content in the book: basic guide to the National Health Service structures, cultural competency. I'd
Yes.
love to talk about that a little bit. Strategies for coping with and flourishing in your healthcare staff role, accelerating staff development and progression in the workplace. Competencies and tools for use in the healthcare setting, measurements, abbreviations, language, terminologies, all the things
Yeah,
that
all
you
the
need
things
to
you
know.
need. Yes.
Obviously, one of those that stood out is cultural competency.
Yes.
Talk about what that experience was for you, and then what you've built into that section specifically, because that's part of thriving in a new culture.
Great.
So let's talk a little bit
Yes.
about that.
Yes.
Yeah.
Yes. So for me, it's quite unique, my cultural experience. I mean, clearly coming from Jamaica, we have a hot country, the beaches, the sunshine every day. You would wonder why would I leave?
Love that. So I know that. Hot
Yeah.
weather, yeah.
And so I did come in the winter in the UK on a train across the country. And I was wondering, where am I going? And not understanding that I'll be landing in a lot of snow, very cold and things like that. So obviously that was clearly a shock to the system.
Right off the bat.
After the sunshine,
The train.
yeah, that's it. So that's actually quite a simple element of the cultural bit, isn't it? The change in the weather. But the other things about embedding yourself into the UK healthcare system and system of other countries, maybe the US, Canada, and so forth. How do you access healthcare, school, dentistry? And how do you access resources that might be available to you? Very basic things. There's something called the Life in the UK test, where for those who are from abroad will complete this test, and it helps you to integrate and know about the country. So all of those information, whatever you might need, accommodation, everything about integrating and embedding is there. But then about what some of the language might mean for you, what if someone says something in the UK, what it might mean. And sometimes it might be indirect and you have to try and spell out what they're trying to say, because sometimes something might be just polite, way too polite for you to really understand what it means. And obviously there's direct language. Some of our internationally educated staff don't speak English as their first language, and therefore there's a challenge around that. So lots of different resources to support that. English qualification and so forth is available.
Part of that, I would think, too, is helping them know how to find and build a community.
Yes, that's it.
Is that what you help them with as well?
Yes, as well. So within the UK, each of the country have their own nursing association. So for me, from Jamaica, we have the Jamaican Nurses Association, the Caribbean Nurses Association with various different countries. And so for each country, they have that. So a list of those and a link to that will go straight into the government website is available, so that once they come in, they can just access the people that they know and people from their country.
Right.
And they can also give them resources and information. And some of that is sponsored by the government as well.
That's great.
Yes.
You know, that drives home kind of the criticality of, while you're adapting to something new and something that's completely new,
Yes.
anchoring to something familiar
Yes.
is really an important part of that process. So your associations
Yes.
and community really help someone stay anchored to what's familiar to them
Yes.
while they're adapting to what's new.
Yes.
So that's really great. Thank you so much for sharing that.
Thank you.
How can people find your book? Where do they go to get it?
Yes.
And I'm going to hold it up so people
Yes.
can see it.
Thank you. Yes. So like we say, this is an official published book by Elsevier, the publishing company. And it's available on the website. If you just type in the name International Healthcare Professionals Handbook, you'll see it come up. And also it's available on Amazon and other book publishers as well. It's very popular. And the discount code for Amazon and Elsevier is BAFF20, and you get a 20% discount.
Oh, that's great.
Book.
Everyone needs to take advantage of that.
Yes.
I would think most people in nursing are familiar with Elsevier. And all of their resources, textbooks for medical professionals. But if you don't, Elsevier is ELSEVIER.com.
Yes.
And you'll find Annesha's book there. What are you excited about here at the conference? I know you have a booth here.
Yes.
You're talking to people about your book. Is this your first ICN conference? Have you been here before?
I've been to the virtual one during the pandemic and presented some of my research, but this is the first face-to-face congress that I've attended.
So what will you take away from here?
Yes, so I'll take away a lot of the network and engagement. For example, I'll definitely be following up with you, Lea, to have more conversation and more work with True Merit. In fact, when I was a younger nurse, I did do the CGNF qualification, which was your previous name, isn't it?
Yeah, CGF and
accreditation and stuff like that. So I think there's lots of work in the WHO, the ICN and other organizations such as True Merit that we can engage with, just to really engage and combine and co-design the workforce resources that we need to fill that workforce gap that we have across the world.
We'd love to get you plugged into the Nursing Workforce Center that we launched with ICN.
Oh, nice.
Around research for nursing globally, and especially around workforce development and mobility.
Yes.
So that would be a great place for us to keep you connected to the work that we're doing and have you participate. Thank you so much for being with me today. This has been a great conversation. Kudos to you for the work that you're doing and have done, and the way that you are helping and investing in the next generation of nurses. To me, that's the most critical part. Workforce development is mentorship and resourcing nurses who are coming not only into nursing, but who are looking at career mobility. So thank you on their behalf and ours for you doing that. Thank you so much for joining me today.
Thank you.
All right, everybody, that's it. That's the end of our episode. Thank you for tuning in. If you are still here at ICN, we've got 2 more days to go. You'll find True Merit in the exhibit hall. First booth when you walk in, key 2A. Where's your booth? So they can come find you.
Severe, just behind you.
G2, right behind the True Merit booth. And if you're tuning into our podcast for the first time, we've been producing and dropping episodes for almost a year now, twice a month. You can follow and subscribe to our podcast at truemerit.org/podcast. That's TRUMERIT, truemerit.org/podcast. We also stream these episodes on your favorite podcast streaming channels, Spotify, YouTube, and Apple. So you can find us there. Just search for Care Anywhere, and that's where you'll find this episode and all of the other great episodes we've been dropping. Thank you for tuning in, and we'll see you next time. That's it for this episode of Care Anywhere. Thanks for joining us. We hope you'll tune in for future episodes where we will continue these powerful discussions about our global health workforce. If you missed any episodes, you can find them at truemerit.org/podcast or by subscribing to our channel on your favorite podcast platform. Just look for our podcast logo or search for Care Anywhere to find us. Thanks again, and we'll see you next time.